all, at least in official figures in the last 24 hours, India is below 3 lakhs for the first time since April. We're at 2,81,386, cases down 9.5%. Deaths, however, again remain high at over 4,000, up nearly 1%. The tests done in the last 24 hours are also down 14%. Yesterday, of course, was Sunday. But the positivity rate is again down, which that's a good indicator, down by nearly 1%. One big worry, however, is vaccinations. Now, just look at these figures. Vaccinations in the last 24 hours are down by 60%, and that is hugely worrying. Vishnu joins me for more on that. So, Vishnu, cases going down, but vaccinations going down is really bad news.
It's all bad news. The vaccination isn't enough, and the testing certainly isn't. We need both of them working together. Now, India's daily COVID cases dropped below the 3 lakh mark for the first time since the 21st of April, with 2.81 lakh fresh infections reported in the last 24 hours. But 4,106 COVID patients have died since yesterday, and the average daily case dip is for the 8th consecutive day. So that, you would think, is actually welcome news, that things might be getting better. But the question is, how reliable is that? Do we actually know what is happening in the countryside? How many tests are being conducted? And again, that vaccination number, very, very slow. So let's talk a little bit about the process of testing. Now, the average number of cases has been up 6 times since April 1st to its peak on the 9th of May. But the average number of daily tests is up less than 2%. So just look at that first number. If we can just go back to that first number once again. 531% is the jump in cases from the 1st of April to the peak of 3.9 lakhs, close to 4 lakhs. But change this and you will see that the number of tests has nowhere kept pace with what we are actually seeing. The more you test, the more you'll know what the situation is. And presently, India is using just 45% of our testing capacity in the middle of an emergency. The capacity is 33 lakh tests every day. We are presently using only 18 lakh tests a day. And that is abysmal because, again, if you aren't using the existing capacity in the middle of an emergency, we could in fact be in deep trouble. So the number of tests in that graphic that you see plateauing out over the last couple of days, it should have been shooting up because we need to do many more tests. Now let's take a look at the All India graphics. 4,106 deaths today. So again, that 4,000 mark, whenever there is a reduction, it's not very, very large. It's back up above that 4,000 mark. It's crossed 4,000 again after 2 days. But while we've been talking about testing, let's also talk about India's pace of vaccination. And this is a real reality check, because the question is this: can India achieve its vaccination target this year? How much longer will we have to wear our masks? So let's bring you some straight facts. India needs to vaccinate 80% of its population. Why 80%? Because with 80% you get herd immunity. Now 80% comes to about 1.112 billion people. That is our target for vaccination. So what is the current rate of vaccination, the pace of vaccination? It's only about 1.8 million per day. It might sound very large, numerically it is, but 1.8 million with this rate, it'll take 3 years and 1 month from today to achieve our vaccination target. We would achieve this target roughly by June when? 2024. Do have to reach the target by the 31st of December this year, which is what the government hopes to do. What do we need to achieve? We need to scale up our vaccinations to 8.95 million vaccines per day. That's about 5 times the current rate of vaccination. Think about that. Is that really going to happen? Now, these are numbers as of now. The vaccines aren't even available. Therefore, if we are to scale up, it can only happen once the vaccines start coming in number. That will happen only sometime in the middle of July.